everyone. Thank you for joining us today. We have Connie, a registered nurse from the health department who has been working in the hotline with us, and she's going to be answering some frequently asked questions. I'm going to step out of the frame so that she can speak with you with her mask off so you can understand her better. And thank you so much for joining us, Connie.
It's a real pleasure, Leah. To be able to talk to a lot of people at one time is great.
When should I get tested for COVID-19?
That's a really good question, and we get it pretty often. And it's a difficult thing for many people to determine. Basically, you should get tested if you're exposed to somebody who tests positive. It is a good idea for you to be aware of symptoms, to know what to look for. If you are a confirmed direct contact to a person diagnosed with COVID-19, you need to be in quarantine for 2 weeks. And during that time, if you develop symptoms, that is probably the best time to go get tested. Prior to that, if you develop symptoms just as a matter of daily course, you get a fever, or you get a headache, that's a good time to get tested too. Other than that, unless you get directed by someone else to go get tested, it's probably best to wait. There are some times that are better than others in that quarantine period. So if I was exposed to somebody yesterday and I found that out today, my best idea would be to wait 5 to 7 days, then go get tested unless I develop symptoms in the middle of that. Your quarantine period for direct contact is 2 to 14 days. So you could become positive anytime in those 14 days. After that time, it's highly unlikely that you would become positive from that particular exposure.